So speaking about active surveillance, if there is a topic that we all get into a fight at morning conference, this is it. Active surveillance is probably, not just in your world, but in our world, the scariest thing. Because it's like playing chicken with your cancer, right? The question is, I have cancer. Should I not treat it right now? The general answer is yes, don't mess around. Unless you're this low grade, this group 1, this Gleason 6, as I've listed there, and sometimes even a low grade Gleason 7, still a grade 2. So grade 1s is a yes, grade 2 is on the fence, but these guys do just fine. Those are the folks that have it for 20 years, and guess what? They pass away of something else. Old age, heart disease, something else. They live to be 90-something, and you die with prostate cancer, not from it. So it's important to know, because you don't want extra treatment, right? If you don't have to get your prostate out, you don't need to get your prostate out. But you want to be confident that your prostate is being dealt with the way you want it to be dealt with. So this active surveillance is the hottest thing. You even have urologists who say, wait a minute, why are we operating? Okay, these are urologists, and there's tons of them here. I don't know where Dr. Lutz is, but the reality is their job is to operate, right? There's a problem, cut it out. They're actually the ones that are telling us, hold on a second. Maybe we don't need to do that. Maybe we got to be a little smarter about it. So the big question, as I said, is it over-treatment, or are we being foolish by not treating? So when I say we get into big debates, we get into big debates. Sometimes people stand up and they're so worked up. They're so, you're going to let that cancer go? You're going to give that guy a problem with his sexual activity because you want to get that cancer out? So it's good to know your doctors fight about your care, because no one has the right answer. But we go back to the tissue and we dissect it and we say, well, what's it look like? You know, all of the 12 biopsies all have a little bit of cancer, a grade 1 or a grade 2 or a Gleason 6 or 7. Already you're uncomfortable, right? And guess what? This man has a family history. His dad had prostate cancer. His brother had prostate cancer. His dad died when he was 70, but his brother passed away at 55. This gentleman is 52. He's got a long lifespan, but should we operate? But he's got a lot of cancer with a really not so happy family history. So many of us at that point would be uncomfortable with active surveillance. We'd say, boy, there's a lot of stuff there. There's a lot of stuff. But if you're the man that has a little dot, a 1 out of 12 with a Gleason 6, grade 1, just one core, your PSA is maybe 4. Feeling great, no urinary symptoms. He'd be the right guy to just follow. And active surveillance doesn't mean I never see you again. Active surveillance means we're just going to hang out together. We're going to work through this with prostate sample exams and digital rectals and maybe an every 6-month or year biopsy. And then we're going to say, hey, guess what? Your cancer's still pretty good. We're just going to keep watching you. Just like when you go in and you get your checkups for your cholesterol or your sugar or your blood pressure. So it's important to get empowered. Know what it is that you are asking.